example. A delay would be the K and the G sound, typically develop between that 3 and 4 years old. Well, it is very common for a child to substitute certain sounds for that. So the K might be a T, so a cat is a tat instead of a cat. Or, the G, they might be dud instead of good. Those are very common errors, but then they should start to grow out of that at between 3 and 4. So that's where the word delay comes in, is if they just are delaying coming out of that. Versus a distortion might be, an S would be a better example for that. So, that the common term lisp.
That's the sibilance?
Yes, exactly. So like the sh, the SH sound and the j sound and the S and the Z's, those are all those sibilant sounds that sometimes it can be distorted, the quality. So the S, might sound more like a TH. So instead of soap, it might be more like a thope. Or, it might come out, the air might come out the sides, might sound like soap or something. That's more of a distortion versus the delay of tat or dud.
How successful are you at eliminating the distortion, the sibilants, like, for instance, the S sound?
Yes.
The sounds instead of the S sound.
Yes. Well, S is a much later developing sound, and the reason being is children, it just takes a little bit longer to control your tongue so that you can produce that one. It's a little more complex. We all take it for granted, but there are a lot of different ways that we have to coordinate our tongue and our airflow to make that S sound, and therefore it is a little bit more difficult, but it is very accomplishable. We start in the easiest form, so we just practice the S sound. We might talk about where is your tongue. We might talk about there may be a weakness that we need to address. So it is definitely a little more difficult, but still accomplishable, and that's where the early intervention comes in. If a child is making these S distortions for 8 years, that's an 8-year habit that you have to break versus, if we can address it earlier, like between 5 and 6, that's a lot better. It's a little bit easier.
So parents and guardians need to be vigilant and not think that these things will repair themselves.
Yes.
What about adults? And I know some, and I even know a couple in broadcasting who do voiceovers who have a little bit of a sibilance problem when it comes to S's. Do they have a physical impairment, or is it a habit? And if it's a habit, 3-part question here.
Yes.
And if it's a habit, how do they pick up that habit?
Well, it's hard to say. Everybody is so different. Is there a weakness? Is it a habit? I think an important thing to consider there is they probably don't even hear it themselves. They're so used to their own voice and how their voice sounds that they probably don't even hear it, which, that's going to be, even before you would work on just an S by itself, you would have to start to hear that there's a difficulty so that you can be aware of it to be able to fix that.